Dr. Bob, I'm 72 and I seem to bruise all the time. Is there anything I can do to keep from bruising? Very common as people get older, two things happen with their skin. Number one, bruising is because little capillaries, little bitty blood vessels will break. Those capillaries, those blood vessels get a weaker wall, and so they're more easily ruptured when you bump into something. Usually the bruise is very, very small. Now the reason that it's occurring is two reasons. Number one, or three reasons, that little blood vessel gets a little bit weaker so it pops easier. Number two, the tissue that supports those little capillaries becomes thinner and weaker, and so there's not as much protection for those capillaries. And number three, the skin in itself gets thinner as we get older, so it's frequent that when people just bump up against something that they don't even think about it, all of a sudden they'll look down at their hand or their forearm or their leg and they'll say, "Oh my goodness, why did I get a bruise? I wonder if something bad is going on. I seem to bruise more easily." Well, it's usually a normal thing that happens to the skin as we age. I was talking to a dermatologist and I said, what can we do to improve the structure of the skin so we won't bruise so easily? And the dermatologist's answer was, when you find that answer, you'll be worth $1 million and can buy that island in the Caribbean. So there's not anything that we can do right now. Vitamin C doesn't seem to help, and nothing seems to be able to help that bruising. And so it's something that we have to learn. Now, if the bruising becomes unusually large and there's no reason that you can think of why you're having bruises, then we need to be thinking of some abnormal problems, especially if you start getting bruising in the trunk, on the abdomen, on the side, on the thighs, on the back. If you get big bruises, we need to think about maybe something in the blood system is not working properly. And that's the time you need to see your doctor and talk about platelet deficiency. Platelets help us stop bleeding. And a bruise is bleeding under the skin there. And so if it becomes too prominent, your doctor will want to measure your blood count and get the number of platelets that are there. And if those are normal, we can go on and get some bleeding studies done. Usually bruising is something we have to put up with, but if you think it's beyond normal, then you talk with your doctor about it.